Welcome back, everyone. You are watching Insight right now here at Stepping Up Physical Therapy, joined by one of the therapists, Jordan. Jordan, it's a pleasure to be here. Today we're talking about back pain, right?
Yes, absolutely.
Oh, back pain. You know, we got to be careful how we're picking things up, how we're mindful of our back. I mean, talk to me about some of the causes of back pain. What are the types of back pain we're dealing with?
So back pain is a struggle because it's something that's going to affect 90% of people in your lifetime. Unfortunately, if you're young and you've experienced it, you get to experience it the rest of your life here and there. It's tough because it can come on with something as simple as an improper bend, a little twist. It can come on after a car accident, all sorts of different things. So you need to know the different structures that are involved when you do have a back injury.
Right.
It's pretty common for a little thing to be more of a muscle strain. You can feel it just kind of diffusely through your low back. But then sometimes you've actually hurt your spine or some of the connective tissues, the discs that are between the vertebrae in your spine. Those can send signals or pain down to your buttock, through your leg, things of that nature.
Yeah.
And even then you get sciatica, which is further down, and that is more the sciatic nerve that's bothered by muscles in that area. So it's tough to tell sometimes.
Yeah, it's just like a domino effect. I mean, as we begin, you know, how do we begin to know, okay, it's time for me to go get checked out? What are those signs that we should be looking for?
Yeah. So there's definitely things that are kind of scary, you know, like if you can't feel your leg, you got to get checked out. Or if it's persisting for a really long time, like I think a lot of us, we're stubborn. We say, it'll get better.
Yeah.
I'm not going to worry about it. Give it a week. And then 6 weeks later, we still haven't done anything. So if it persists longer than a week, probably, it might be a good time to get in and get checked out. Because if something is not healing correctly, just like if you broke a bone, you don't want it to heal improperly. You want to get it checked out, make sure that you can get the process started to get back into normal life quickly.
Yeah. So, what are some of the things that we can do? Obviously, you know, when we come in, we make that appointment, we get that imaging done. But what are the steps that we should be taking with being able to go through that healing process?
Yeah, it's what I really like to do is I like to use movements to kind of tell people what's okay. You think about the way your spine moves, we can go in all sorts of directions, but if you break it down, it's forward and backwards, side to side, and rotating.
Yeah.
And so if you notice that one is specifically irritated, you kind of got to tease it out a little bit. That's what I will do with most of my patients on day one is say, what's bothersome? Does the opposite movement help it? How can we kind of play into improving your mobility? And a lot of the time that muscle tightness or nerve pain go away.
Yeah.
It's not easy, but it can be fairly simple with some guidance.
Yeah. As we talk about, you know, finding those little ways you kind of feel a little something. I know that back pain or kind of pain overall is something that kind of can build over time. So even if you have that small pain that's maybe right in the middle of the spine, it's good to just go ahead and get it checked out because as it builds over time, it just gets worse and worse, right?
Well, and like I said, it's something that lots of people deal with. And I don't care what you do. I don't care if you sit at a desk, if you work construction, if you're in a factory, there's good and bad for your back in all areas. And if it hurts now, it will hurt in the future if you don't do something about it.
Okay, so what advice would you just give for people who are first of all saying, look, I need to go ahead and get this checked out? What are those steps they can get in with getting in with Stepping Up Physical Therapy?
Yeah, so it's really easy. Most insurances do not require any sort of an order anymore. Some do, but you just call up our main office and they can get you scheduled with a therapist that's closest to you based on where you live and what location is closest.
Okay.
Certain insurances do require other things, but it's pretty simple. And if it takes anything else, all you have to do is go to your doctor. They're almost always glad to recommend therapy.
Yeah, well, look, pain is something that we don't want to play with, especially back pain, because that mobility can affect all your parts of your body, right?
Absolutely.
All right. Well, look, thank you, Jordan, for being here with us. We appreciate you very much.
It's a pleasure.
All right. Y'all be sure to stop by, check out Jordan and the rest of the fantastic physical therapists who are here at Stepping Up Physical Therapy. Take a look at your screen and find out more. We'll be right back.